This presentation covers the fundamental aspects of bloodborne pathogens, including how you can protect yourself from potentially dangerous microorganisms found in blood. At Thompson, our goal is to avoid all accidents, but we want you, as an employee, to be informed and know how to protect yourself if you are ever exposed to blood. Bloodborne pathogens, or BBPs, are microorganisms found in the blood of infected humans. There are three primary categories that contain bloodborne pathogens: blood, body fluids, and human tissues and organs. When you think about potentially infectious body fluids, blood probably comes to mind first. But what other body fluids could be infectious? Saliva, vomit, urine, and semen are all potential sources of BBPs. Other fluids in the body may contain blood and should be noted. One is pleural fluid, or the fluid around the lungs. The other is synovial fluid, the fluid found around many of the joints in our body. Careful treatment of BBPs is important because of potential exposure to some very harmful diseases, such as HIV and hepatitis B and C. HIV is the virus that leads to AIDS. AIDS attacks the immune system and makes it difficult for the body to fight off infection. HIV does not survive very long outside the body. Dried blood poses little threat of transmission. Tears, sweat, and saliva also pose little threat. Medically, they have never been shown to transmit the disease. Hepatitis B infects approximately 1.25 million Americans. This disease attacks the liver and often leads to chronic liver disease or liver cancer. Its symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, and vomiting. It is unlike HIV in two important ways. First, there is a vaccination for HBV. There is not a vaccination for HIV. Second, while the HIV virus can survive only a very short time in dried blood, HBV can survive at least 1 week. In the United States alone, approximately 4 million people are infected with hepatitis C, making it our country's most common chronic bloodborne infection. Like hepatitis B, it attacks the liver and often leads to chronic liver disease and liver cancer. Its symptoms include jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. Many people do not know that they have hepatitis C until they already have some liver damage. This can take many years. Some people who get hepatitis C have it for a short time and then get better. This is called acute hepatitis C. Sadly, most people who are infected with the virus go on to develop long-term or chronic hepatitis C. When we talk about potential transmission of BBPs, we are looking at contact with another person's blood or potentially infectious material. Other potentially infectious materials refer to those we discussed earlier: saliva, vomit, urine, semen, pleural fluid, and synovial fluid. You also need to think about contact with another person's mucus from membranes in the eyes, mouth, and nose. Though mucus does not normally contain blood, blood could be present in some situations, such as after an injury or even after a respiratory infection. Non-intact skin, perhaps from an injury, poses a threat of transmission, as do contaminated sharps or needles. OSHA's Bloodborne Pathogen Standard requires employers to identify the jobs, tasks, and activities that could expose employees to potentially infected blood or body fluids. Exposure could occur when near someone who is involved in an industrial accident. Obviously, when administering first aid to someone who is bleeding, you face potential exposure. Employees responsible for cleanup of work surfaces, equipment, or machinery after an accident are also potentially exposed. Janitorial workers are potentially exposed when cleaning up urine, vomit, sanitary napkins, etc. Maintenance workers may potentially be exposed when performing routine work repairing the plumbing on a toilet. OSHA's BBP standard also requires employers to have a written Exposure Control Plan, or ECP, which must be available to employees at all times. Thompson's written ECP is included in our Policies and Procedures Manual. If an emergency occurs and you are unsure of the proper procedures to follow, notify your foreman, supervisor, or safety manager immediately. OSHA requires the ECP to be reviewed and updated annually and whenever necessary to reflect any new or revised employee tasks and procedures that affect exposure or any changes in technology that reduce or eliminate BBP exposure. The employer must consider and implement the use of safer medical devices designed to eliminate or minimize exposure and must document this in the ECP. The standard also requires that non-managerial employees who are potentially exposed to injuries from contaminated sharps be asked to help identify, evaluate, and select effective engineering and work practice controls. The employer must document the request in the ECP. There are several forms of inexpensive but very effective personal protective equipment, or PPEs, that you can use to prevent exposure to BBPs, such as waterproof gloves, safety goggles, and smogs. An important part of preventing exposure to BBPs is proper decontamination and cleanup. As with all body fluids, assume contamination and wear protective gloves. Latex gloves can be found in most first aid kits and also with your supervisor. The body fluid disposal kit contains fluid cleanup materials such as an absorbent powder, a disinfection solution, and a disposal bag. The powder can be sprinkled on liquid body fluid such as blood. When the powder absorbs the fluid, it can be scooped up and placed in the disposal bag. If no disinfectant solution is available, it can be substituted with a solution of 1/4 cup of bleach per gallon of water. Wipe down all contaminated surfaces with the disinfectant solution in order to ensure that all BBPs are destroyed. Dispose of all contaminated gloves, towels, rags, absorbent powder, etc. in a designated disposal bag. These are some common sense, safe work practices that will help prevent exposure. First, always follow the universal precaution, which means treating all blood and body fluids as though they contain dangerous pathogens. Remove contaminated clothing or PPE as soon as possible and wash your skin in the area underneath the clothing that was contaminated. Remove contaminated PPE such as gloves as soon as you are finished administering first aid or decontaminating equipment or work surfaces. Cleaning and disinfecting tools, work surfaces, or equipment will prevent the next user from knowingly coming into contact with potentially infected body fluids. Thoroughly wash your hands, face, and any other areas of your skin that may have come into contact with body fluids. If you believe that blood or other potentially contaminated body fluid was splashed into your eyes, go to an emergency eye wash station immediately and flush your eyes. Finally, properly disposing of contaminated items in appropriately labeled bags or containers will help prevent someone from accidentally being exposed. Another way to prevent potential exposure is through communication, which includes appropriate labels and signs. All regulated medical waste must be labeled in accordance with EPA requirements for biohazard wastes. If the material is not regulated, such as liquids that are adequately absorbed or Band-Aids, it can be disposed in an unlabeled bag and discarded in the trash. Refrigerators that contain biohazards should be labeled, and no food items should ever be placed in them. Any container that may store potentially infectious materials also must be adequately labeled. An exposure incident is a specific incident of contact with potentially infectious body fluid. If there was no infiltration of mucous membranes or open skin surfaces, it is not considered an occupational exposure. If an employee administering first aid on normal bleeding is wearing the appropriate gloves, then an exposure incident does not exist. Be sure to report all incidents involving blood or body fluids so the company can determine if an exposure occurred and then offer post-exposure medical evaluations if necessary. After each accident, an accident investigation report must be completed. If blood is spilled, documentation of the spill location, who cleaned it up, the cleanup method, and waste disposal location must be kept. This concludes this segment on bloodborne pathogens.